Hi, I'm Dr. Dean St. Mart, formulator for supplement needs, and in today's video we're going to discuss our newest addition to our range of cardiovascular health supplements, and that's SerraNatto Plus. So SerraNatto Plus is the final addition to what we could consider a trifecta of cardiovascular protection supplements composed of CB Stack, CB Pro Plus and now SerraNatto Plus. So we're all familiar that the CB Stack is there to help with your HDL production and lowering LDL oxidation. CB Pro Plus is there to support lowering LDL synthesis, helping with cardiovascular muscle health and helping with lowering your blood pressure as well as lowering inflammation. And now we've got SerraNatto Plus, which is an advanced proteolytic enzyme supplement. Sounds quite fancy, doesn't it? Which is effectively designed to help, first and foremost, be anti-thrombotic, which is breaking down thrombi or blood clots. And secondly, to be anti-inflammatory and fibrinolytic. So if we look at SerraNatto, it's made up of 4 ingredients, and they are serrapeptase, nattokinase, bromelain and rutin. As you can see, it's quite a simple formula, but it has some very nice mechanistic properties which helps to protect your cardiovascular health. So to start, natto is a Japanese food, and from that, in the past, they were able to isolate nattokinase, which is the active enzyme within the food. Nattokinase is a very interesting enzyme because first and foremost it has anti-thrombotic and thrombolytic properties. So basically it helps to stop the formation of blood clots and helps to break them down. It also helps to inhibit ACE formation. So ACE is an enzyme in our body that gets converted to ACE2, and ACE2 effectively constricts our blood vessels and increases our blood pressure. So nattokinase does have some evidence to support lowering your blood pressure. But the two main sides to it are when we have a wound, we end up creating a fibrous cross-linked protein, and that tends to be called fibrin, and it's produced from fibrinogen. Nattokinase helps to limit the activity of fibrinogen so that we don't form fibrin. It also helps to upset how plasminogen works, and plasminogen effectively forms plasmin, which is what forms blood clots. The second ingredient, serrapeptase, is a zinc-containing enzyme, and that helps to hydrolyze polypeptides within our bloodstream. So effectively it helps to break down proteins. But again, we're not really looking at proteins in the sense of amino acid based proteins for muscle protein synthesis. We're really looking at fibrous proteins, or in other words scar tissue, and we're trying to limit that scar tissue potentially depositing in the artery or causing a blockage that could, in other words, trigger off a blood clot being formed, which if it makes its way to the heart or the brain, we either have a heart attack or a stroke. The second two ingredients there are bromelain and rutin, and they're there to effectively support the activity of serrapeptase and nattokinase. Bromelain, you're probably well familiar with, is an enzyme that is actively present in pineapple. It's a proteolytic enzyme, so it helps with protein digestion, but again it helps with breaking down fibrous proteins in the body. And rutin is a glycoside, so glycoside is effectively a sugar containing molecule So we have rutinoside attached to quercetin, and we all know how powerful quercetin is as a antioxidant and also for lowering histamine in the body. When we have quercetin 3 rutinoside, which is effectively rutin, the literature shows that it helps to lower LDL, so it has LDL lowering properties which will support your cardiovascular health, and it also has anti-thrombotic effects in that it helps to offset the production of blood clots. So as you can see, it's quite a simple formula. It's 4 ingredients, but they do have critical mechanisms within the body to help obviously support your cardiovascular disease in the way of lowering your blood clot risk and your fibrous scar tissue formation in the body. The daily serving is 2 capsules, and this is ideally taken upon wake. We want to take it on an empty stomach so that the proteolytic enzymes, obviously they will break down proteins. If we take it with food, they will break down proteins that we ingest in our food, and we're going to upset the potential benefit of those proteolytic enzymes from breaking down clots. So it's best taken on an empty stomach and giving yourself about an hour before ingesting food to allow the enzymes to be absorbed appropriately. So that's SerraNatto Plus, the final addition to our trifecta of CV supplements. I'm Dr. Dean St. Mart, formulator for supplement needs. Thank you for listening.